Welcome to Sunday Science, where we dive into a few recent scientific articles and their translation into our modern lives. Here is your host, Brent W. Laartz, MD.
All right, everyone. Welcome to another episode of Sunday Science. Here we're going to be discussing an article, just a single article this week, because I'm kind of on vacation here. What a beautiful place this is. You can't see, but I can see right out the window here, Clearwater, Florida, on the beach, enjoying a beautiful vacation. But I'm going to be working a little bit, just a little bit, reviewing an article here. This is a really good article about biological aging across different diets. And they took out of the UK Biobank, they took 400,000 people. Out of those, they found that there were 213,000 meat eaters, and that was called regular meat eaters, defined as greater than 5 days of eating either red meat or poultry per week. And then they defined another subset that was low meat eaters. These were people who ate less than 5 days of meat, poultry or red meat per week. Those that were called pescatarians ate only fish and no meat or poultry. Then they had another subset, and that was 9,313 out of the 400,000 people. 7,477 additional people were defined as vegetarians. These were people who ate no meat or fish. Some of them could have been dairy. They could have been had dairy or not. So there were about 1,500 people, I think the number was, out of those that were completely vegan. And then they took those patients that were in that, and they had multiple different blood tests available to this study. And they were able to match 8,000 of those that had a median follow-up of 4 years, and then could detect, based on the blood tests at 4+ years later, whether or not they had an accelerated biological aging. So they did two different calculations: the Clemara-Duval method, KDM-BA method, which includes the forced expiratory volume in 1 second, the FEV1, systolic blood pressure, albumin, alkaline phosphatase, BUN, creatinine, CRP, glycated hemoglobin, and total cholesterol, which is an extensive biological age method. Okay, so then they also had a PhenoAge, which has a shortened or abbreviated number of biomarkers. And they took these two different scores of biological age. And then they also were able to categorize these people based on a biological age. So they were also able to categorize these persons by a PRS, which is called the polygenic risk score. This score is a genetic score based on different genes as to the risk of mortality, low, medium, and high risk, 3 categories. And they were able to tease these out again to make sure that there was not any genetic cause of this. Okay, here's what we found. So at the baseline, again, 400,000 people, and they had a baseline, and I'll bring this up here, the KDM-BA acceleration. So you can see, for those of you on the video podcast, this shows the KDM-BA acceleration. So they take the regular meat eaters and they use those as the baseline of 0, and they compare the low meat eaters, the fish eaters, and the vegetarians. So in the low genetic risk category, there is approximately minus 0.56 beta coefficient. So in other words, for every year that the regular meat eaters had for a biological age, the low meat eaters were 0.5 less. So in other words, they were approximately 0.5 years less of a biological age. Fish eaters had an average of -2. Vegetarians also -2, a little bit more decrease in the biological age for the fish eaters in most of these calculations. So approximately -2 years for the biological age, according to the KDM-BA acceleration for the low genetic risk. And this held steady for the medium and high genetic risk. So regardless of whether your genetic risk was low, medium, or high, the low meat eaters had a slightly lower biological age. The fish eaters and the vegetarians had at least 2 years, 2 to 3 years less of a biological age, regardless of their genetic risk. Again, here you can see in the medium genetic risk that it was approximately 2.32 for the fish eaters, negative 2.74 for the vegetarians. Again, here, look right here to the high genetic risk, minus 0.67 for the low meat eaters, approximately 1 year less, and this was statistically significant. And then the fish eaters minus 2.61, vegetarians minus 2.1. And you think, why would that be? Why would fish eaters be any better? And somewhat obvious could be some different nutrients that you get, such as perhaps omega-3 oils from the fish eating. Okay, so here with the PhenoAge, again, PhenoAge is a abbreviated panel of PhenoAge acceleration. You can see that regardless of low genetic risk, medium genetic risk, or high genetic risk, approximately 0.2 to 0.6 years difference in biological age based on that. So again, decreased biological age acceleration amongst these people using the PhenoAge acceleration. The really important part here is really the next slide that I'll show you. And this slide is showing the acceleration. In other words, the comparison from the baseline to the end. And so you have with a consistent diet pattern of a regular meat eating at 0, you can, for 4,800 regular meat eaters, there were 3,400 low meat eaters, and they aged over that 4.4 years, almost 1 year less during that 4.4 years. And the fish eaters aged approximately 1.78 years less, and the vegetarians approximately 2.3 years less. And this was on the KDM-BA acceleration pattern. Then with the PhenoAge, again, the abbreviated numbers here, anywhere from 0.2 to 0.5 years less of an age acceleration over that 4.4 years. So pretty significant there, showing that that there was a major decrease in the aging of those people who were either lower meat eaters, although that was a little bit less, and the persons who were either pescatarians or vegetarians had a marked decrease in the biological age acceleration from baseline to 4.4 years later. Again, so really striking. And again, we've had a lot of data regarding this kind of pattern for biological age. In the show notes, we're going to give you the article. This is in the Clinical Nutrition Journal. The article name is Biological Aging Across Regular Meat, Low Meat, Pescatarian, and Vegetarian Dietary Patterns, a population-based cohort study. So a lot of other studies have had just either a cohort snapshot. This gave us a snapshot of this, and also then took the patients on a longitudinal 4.4 years later, showing that they not only started at baseline lower, but they aged less in the 4.4 years of follow-up. So again, so what is the best diet? The best diet is something that's best for you and what you can tolerate, right? But there is remarkable data for some of these either lower meat eating diets. Those would be sometimes either the Mediterranean diets or the Mayan diets, but these all have lower meat and more fish, and potentially the even better than that is going to be potentially your vegetarian diets or pescatarian diets, which are even more strict at getting rid of meat. All right. So, again, thank you very much for joining us again here on Sunday Science. We love having you here. We were going to really accelerate our aging of this and try to get as many more studies to show you how you can impact your aging and your longevity. So, thank you very much for joining me. Again, you can find us Sunday Science on Video podcast on gounpro.com. You can find us on Substack. You can find us on YouTube and Spotify and Apple Podcasts. To find the video, it is in general has the blue artwork for the podcast. If the podcast has a purplish maroon artwork, then this is going to be the audio only. Okay, so if you're trying to look for us, I'd say search either GoUnPro or Brent W. Laartz MD on YouTube. I think that's probably the easiest way, but also gounpro.com. That's GOUNPRO.com. Thanks for joining us and happy Sunday.
This site and any information communicated within it are not intended as medical advice. The information herein is not intended as medical care, diagnosis, or treatment of any medical condition. No component of this content, including discussion or comments, shall be construed or implied as establishing a doctor-patient relationship. Before you translate or copy any of the information, diet, exercise, or products utilized herein or on any social media post to your own practice, consult your own research, physician, therapist, or nutritionist for your own health. No warranties or claims are made as to the benefits or risks of any treatments, diet, exercise, or products herein. Research any treatments, diet, exercise, or products thoroughly before trying for yourself. Referral, affiliate, or advertising fees may be garnered by this site.